Controlled Substance Agreement. If you're on a controlled drug for more than 90 days, you will be asked to sign a Controlled Substance Agreement. Let's take a look at the Controlled Substance Agreement now. It contains a lot of very important information. Please be sure to read it all. This video is formatted for adult viewers and for parents or guardians of minors who may be receiving a controlled drug. Controlled drugs may be prescribed to reduce pain, anxiety, or attention problems, improve function or activity such as sleep or school performance, be used along with other treatments. Drugs work best this way, such as physical and occupational therapy, exercise, and modifying study habits. Controlled drugs have risks, such as side effects, which is nausea, constipation, confusion, and sometimes more pain, negative interactions with certain drugs, including alcohol, which should not be used, dependence, tolerance, and withdrawal, which could be illness with sudden stopping of the drug, including newborns, and abuse and addiction, which is loss of control over the use of the drug. In order to ensure your health and safety, it is very important that the Controlled Substance Agreement is reviewed and signed. Not following this Controlled Substance Agreement may result in the WellSpan Health not being able to prescribe your controlled drugs. WellSpan Medical Group Office agrees to protect the privacy of your medical information as required by law. We may share information, such as the use or concern for misuse of controlled drugs with other healthcare providers. To do our best to help you function better, even if it means we need to stop your controlled drugs. To prescribe your drugs aware of medical guidelines, we will help you avoid side effects, misuse, abuse, and addiction. To tell you if there is concern about controlled drug misuse, and if needed, we will help you heal from addiction. By law, to report to the Department of Transportation if we believe that the drugs may affect your ability to safely drive a vehicle. To follow state and federal laws, such as checking computer records when prescribing controlled drugs. To always treat you with dignity and respect as a partner in your care. The patient agrees to get controlled drug prescriptions from this office only. If I get any controlled drugs from anywhere else, I will call or secure message this office by the next business day. To tell other healthcare providers about this Controlled Substance Agreement, which includes emergency departments and urgent care centers. Let's go over some scenarios. Say you go to the dentist for an abscessed tooth and receive a prescription for a small dose of a controlled drug for pain. You must inform our office by the next business day to inform your doctor or advanced practice clinician that you have been prescribed this drug. Let's also say a Controlled Substance Agreement is signed and in place at our office for an anxiety or ADD, ADHD drug, but you hurt your back and you're seen by an orthopedic doctor or advanced practice clinician who prescribes you a controlled drug for back pain. You must inform our office by the next business day. Many patients find it easy to secure message the office with information or refill requests through the use of My WellSpan Patient Portal. If you're not currently set up to access this, please ask the staff to help you register. The patient also agrees to not miss appointments and be willing to use other treatments that may be recommended. To request refills 2 business days before running out. Allow 48 hours for refills to be processed, and call for refills only during office hours. If you're calling on a Friday afternoon, weekend, or holiday, please remember your refill request will not be processed that day. Even if your physician or APC's office is open on Saturdays, this is not considered a business day. Do not use more drugs than prescribed, and do not request early refills. Do not take any extra doses without first informing the office, and do not request early refills due to running out of the drug too soon. It's important to note that if your pill count comes up short due to taking extra doses of the drug, this will go against the agreement you signed and may be considered a violation. Keep all drugs out of reach of children in a secure place, and do not request a prescription to replace a lost or stolen. Your drugs will not be replaced if you drop them in the toilet, leave them at the beach, have the pills stolen from your purse, etc. Please keep your drugs safe, and it is best to lock them up. Do not share drugs with anyone, including family and friends. Do not sell them to anyone. Do not take street drugs or any form of marijuana. And please treat my treatment team with dignity and respect. The patient also agrees to having pill counts and urine drug screening when requested, even if I must pay for the test. Urine drug screening is much like the blood work that is required for certain drugs, like blood thinners and drugs for thyroid problems and diabetes. If a patient cannot or will not go for the required testing for these drugs, the doctor or advanced practice clinician cannot safely prescribe them. The same is true for controlled drugs. You could be called to come to the office at any time for a pill count and/or urine drug screen. We will offer you 2 to 3 days to return the call and come into the office. Please bring along your drugs with you in the original bottles. We may also do pill counts and/or urine drug screens at the time of your office visit. Please always come to the office with your drugs and be prepared to use the bathroom. You may not be able to return to the office at a later time if you cannot make it to the office on the day testing is requested. You may not return later if you cannot go to the bathroom. And you will not be able to bring in missing pills after your pill count is already completed. Some patients on ADD, ADHD drugs attend colleges out of this area. We ask that you please discuss this with the office. Let's review. Can you answer these questions? What could cause this office to stop prescribing my controlled drugs? What if I cannot go to the bathroom when I'm asked to provide a urine specimen? What happens if I run out of my drugs on a Friday afternoon? What steps do I need to take if another prescriber gives me a prescription for a controlled drug? Please review your answers with our staff. There are multiple scenarios that could occur with each question, as every patient could have different situations. Frequently asked questions. I've been on this drug for years and have never had to do any of this before. Why are you making me do it now? This drug can cause harm to you and our community if it's not used the right way. In 2016 in Pennsylvania, 13 patients died of a drug overdose every day. This is at an all-time high. As many as 4 out of 5 individuals with addiction can trace their drug abuse back to the drugs that were initially prescribed to them or to a family member to control pain or anxiety. Why are you treating me as if I'm a drug addict? We understand that some of our patients may feel our actions are suggesting that. We do not mean to accuse you of being a drug abuser. We know that most people who are prescribed these drugs are not misusing them. However, the controlled drug that you're taking could potentially cause you harm and get into the hands of the wrong people. It is a nationally recognized best practice to use urine drug screen testing and pill counts to keep all patients and communities safe. I have a child under 18 on an ADD ADHD drug. Why do I need to be aware of this? And do you really plan to drug test my child? ADD ADHD drugs come with potential dangers too, including abuse and getting into the hands of the wrong people. It is important to make sure that your child is the one receiving the drug and is taking it as prescribed. Please make sure all your questions have been answered. Don't forget to take a copy of the Controlled Substance Agreement along with you so you can read it again later and refer to it as needed.